Okay. My name is Mike Lewis. I am a benefit specialist for forensic community-based service with the Office of Behavioral Health. And thanks for having me today. Something that's kind of come up actually back in 2012, if we back up to the unfortunate incident of the Aurora Theater shooting. There was $33 million that was allocated from Governor Hickenlooper to take care of mental health crises throughout the state. Part of it, there was a really good thing, the 800 number, crisis number, that was instituted. I believe it's still running, going great. The other part is the transition specialist program. It's already on its second, contract. First one was with BHI. This one's with Rocky Mountain Human Services. But there was a third aspect that just kind of fell off the radar, and that was the 2 16-bed transition facilities that were supposed to be state-run. And these were either assisted care facility level, independent below that, or the nursing home care. And that was going to be a part of the $33 million. I asked about it probably a year later, and they said that had been scrapped and that there was nothing they could do about it. So part of my job is FCBS. We manage the not guilty by reason of insanity folks that are out in the community. We have about 178 clients. Obviously, there's the consent decree that's going on, and this, if you had 2 16-bed facilities that are state-run at those levels, what you could do is the difficult-to-place clients or patients from this hospital, from this institute, we've got a couple cases that we're trying to get them to nursing homes right now. One person's been here 44 years, has a tremendous lot of awful things in his records. He's been doing great over the last numerous years. He could live very comfortably in a nursing home. Problem is, everybody looks at the packet and says, we're not going to take a chance on this person. If we had a 16-bed facility at a nursing home level of care, we could get him out, get him in there for 6 months, see that he's doing a great job. Then we could start marketing him to these other facilities that could see that he's doing something outside of the state hospital and be able to do it. And it'd be a rotating basis, especially with these ITPs that are coming out. It'd be you could knock 32 beds in a heartbeat. You'd get Medicaid dollars to pay for the monthly care and maintenance, because these patients would be out of the hospital, and be able to have their Medicaid and their Social Security benefits to pay for that. You get Medicaid for the nursing home side of the house. We have difficulties when we have to place sex offenders in nursing homes. Pueblo doesn't have a problem. We can't have everybody going to Pueblo. People need to get back up to where their families are and to their catchment. So